future of medicine must be digital.
Diagnosing anxiety is not a big problem.
It's just done to create clicks and impressions. Honestly, there's another hidden agenda behind it.
But what to do? I mean, I have to go through all this. I only have 7 minutes maybe. And we have to also support healthcare professionals because they need the right stats to make sense of it.
You democratize the access to so many more services because it's digital. You can access with a mobile phone.
Emotion said, I'm afraid of inhalative corticosteroids. I said, that's impossible. Your life hangs up on it.
The data exists already today. Number one step is triangulating the data, bringing it together, then making sense.
Having a really good doctor and a good digital tool. This is 2 things we need to have.
2, 1, go ahead, Lisa. The stage is yours.
Hello world. This feels very new to me. I'm actually a medical doctor. I'm not a podcast host, so I'm a little bit nervous. But I'm more than that incredibly honored to be here. And I'm also so excited that we're finally launching this podcast. So as I said, I'm Lisa. I'm a medical doctor and my normal job is actually to explain diseases or treatments to patients. But over the years, I've realized that this is not enough. So information alone is definitely not enough. I could spend literally hours to explain the disease, the treatment, and still that doesn't mean necessarily that it will help in someone's daily life. Because living with a chronic disease is so much more than understanding just the science behind. The real challenges don't happen in my consultation room. They are happening at home or at work. And that's exactly why I'm so excited to be here, because this podcast will give us the opportunity to talk about all those things, the friction points, the challenges, and maybe we'll find solutions for them. Probably we will discover more problems, probably both. But I think most important is that we are here together, which is incredibly valuable because we can talk about it together with so many experts. And because of that, I also can't do it alone. And we will have also in the next episodes, general practitioners, pulmonologists, pharmacists, maybe also people from the industry, healthcare experts. And most importantly, we would also try to find some patients to talk to. Because I think the most valuable thing is that we can bring different perspectives together and try to solve problems together. And also today, I'm already joined by amazing guests, and I would really like to take the chance to introduce you shortly. So we have Dr. Friedrike Bruchmann, also called Rike, the CEO and founder of a digital therapy companion app called Brite. And I also would like to introduce Confidence, the CPO of this app. Also Forbes 30 under 30. How exciting is that? I'm actually very jealous. So I have only 2 more years to achieve the same. I'm working on that, and also later I will introduce another guest. I'm really looking forward to that, but to make it a bit more exciting, I will share this information later. So, hi, Rike and Confidence, nice to have you here.
Thank you, Lisa. What a great introduction.
Can we directly jump in with some icebreaker questions?
I think icebreaker questions it's a good way to get to know each other.
I will show you something now, some healthcare myths that are going on right now, but also like some news on healthcare. Mm-hmm. And I will just show you something. I will read it out loud and then you will give me your thoughts, okay? First trend, which is the garlic into the nose trend. And I want to show you and you just have to tell me.
When I have a sinus infection, I put garlic cloves up my nose. So here we go. Just watch.
Yeah, okay, it's enough, I think. So this is obviously a trend where people put garlic in their nose to relieve congestions. Have you ever heard about it? What are your thoughts on that?
No.
I feel I'm too old. I'm not on these channels. I haven't never been on these channels. And these trends are not passing my screens. No.
I've never heard of this before. And also that's quite disgusting. Why would you put that on the internet?
But you know what? This is just done to create clicks and impressions. Honestly, there's another hidden agenda behind it. Obviously, this is not a medical reason. This is like one of these stupid things to get viral.
The next trend, I'm pretty sure you heard about it, is typing your mouth when you go to sleep. So have you heard about it? There are people who are really like closing their mouth with a tape, so they can just breathe through nose, which should help for some diseases like obstructive sleep apnea. Mm-hmm. What do you think about it?
Okay, I'm really embarrassed to say I have tried this trend actually. Only once before I realized that there was no medical backing behind it, or at least very little peer-reviewed studies behind it. But I think the idea was like to improve nose breathing, and so you don't mouth breathe, especially when you're sleeping, and more for aesthetic purposes. Apparently it helps with your jawline. Didn't work for me, but...
Are you talking about the soft maxing stuff?
Okay, I'm not that into it, but I heard that when you breathe better from your nose, it helps your nose bridge stay more, I guess, firm, something like that. So I have tried it. Nothing happened, and I'm embarrassed to say that on camera.
I haven't heard of it. I didn't try it, and I think again I feel like super old when I hear these trends because they usually go viral on social media, and apparently I'm not on these channels, so I don't know. But yeah, if there's not any medical background, but isn't this like a study like on why
Yeah,
it
this
should
is
be beneficial?
Yeah, it's actually a study, but the outcome is that of course it's not beneficial, and it could also be
Oh,
a bit
okay.
dangerous if you close your mouth because then you
Yeah,
only can breathe through the nose, and would also be afraid of it. I must admit, actually.
it looks
But
super ugly. It's
don't
like no,
talk
it's a bit like the same with the girls that put like that want to have like wake up with curly hairs and that put like socks around their hair during night and then they woke up and the next day they look like gorgeous but during the night like look like so bad and I don't understand why they would do it to look like this during night next to somebody else. But okay.
Maybe they're
It's
alone. Maybe they're not next to somebody else.
But now maybe we have a more serious topic or a more relevant topic because there are already some AI models you can talking to and they record your voice and then they can like analyze if you are at risk for anxiety or depression or a panic attack. And I think this is, I will start with my opinion on that. I mean, if the models are good enough, it's really good because on the one hand, you are talking to you about your fears, about your anxiety to someone, which can you already calm down a bit, even if the AI can't help you. But like just talking about it could relieve a bit. And if AI is also like recognizing some patterns in your voice, I think it's a good approach. What do you think about it?
I think it makes sense on one hand. I think on the other hand, maybe this is just like a product thinking thing. I like to start from the problem. So what is the problem that we're trying to solve? Is anxiety diagnosis on the decline? I don't think that's the case, right? So anxiety is high and increasing in today's society. However, diagnosing anxiety is not a big problem. So this seems I don't know that this is a problem worth solving, but maybe I'm thinking about it too one-sided.
Yeah, it feels like a bit like technology can solve many things, but doesn't make sense to do it because, like, why? I mean, I could more imagine I'm leading a company and then I want to introduce this technology to make sure to have like warnings what my workforce is going through, for example. Yeah, but this is like a stupid case, but these are more use cases of which I can think of that those technologies can apply. But I think in the regular medical setting, like if somebody is anxious or has mental problems or whatsoever, this is usually very obvious. So I don't know what other medic or illnesses this technology can detect. So if these are hidden diseases, I think it absolutely makes sense. But such cases, is it just for anxiety and
I
for
think those
depression or what?
Yeah, mental health, like depression,
Can
Yeah.
you
anxiety.
show the article again? Maybe like, because this just at first glance.
we can scan through.
We will not read that in our confidence. I'm sorry, we will not.
That's okay. That's okay. That's okay.
But I can send you afterwards.
Okay.
Okay, but
Yeah.
I feel like super German because I'm very critical. Confidence, you should react otherwise. You should be like American, say, "Wow, this is so cool," and we can do multiple things with it.
But only if it's a problem worth solving. Although now that I see it again, if you scroll to the top, it says to detect early detections of cognitive health decline. So maybe it's not about anxiety or depression. It's more like, how do you say, predictive analytics or like predictive signals on mental health problems or like mental
Yeah.
degeneration that's to come. In that case, yes, then it makes sense. But I think this is the thing about like new technology. Then I can see ways of people like exploiting it, right? Trying to like optimize things that there's no problem for quite yet. But yeah, I think it makes sense. Interesting. Although I liked your point, Rike, though. I think there's more immediate use cases for it.
So do you have heard about other top stories this week you want to share right now? Maybe you also have some nice insights read on LinkedIn, social media, I don't know.
Uber Eats is acquiring delivery hero for 30 billion euros. It's not the healthcare. Yeah, it's not healthcare relevant. I mean, it was obvious, but well, this is what I read. I think this week nothing like very specific came for healthcare. But yeah, Uber Eats is acquiring Delivery Hero. That's a big news. I think it was like, everybody could see this coming because of all the history. But yeah,
I take way too many Ubers in Munich, which is really embarrassing. I think this is one of my most American traits. And a few times I've been in the Uber, more than once, and the Uber was like, "Oh, hey, confidence." That shows you how few Uber drivers there are in Munich. And how many times we've taken an Uber. Speaking of which, but their last acquisition, I don't think went so well. Like Uber or Uber Eats or Uber acquired, not Delivery Hero, this beverage delivery service in the US a couple of years ago that I think ended up dissolving. So I'm interested to see how this pans out, to your point, Rike.
I mean, the brand is surely disappearing, and then it's just going to be Uber Eats. They're going to take the distribution channels, all the partners. I mean, it's a bit sad that we are leaving this, or that we are leaving or losing it again, like another big startup from Berlin. But when you look at the acquisition and mergers, usually that big US companies take over. At some point, shareholders want to have an exit, and this, I think, was also the case. That I think one of the bigger shareholder put pressure on Niklas to also pursue an acquisition opportunity.
Does that make you nervous about, I read in some article like the Wall Street Journal, something about that we're going into this age of the great monopoly or the great acquisition, right? Because everybody's doing growth by acquisition strategy. And now maybe in the future, we have 4 big companies that basically run the world. I don't know how I feel about that. It feels less equitable. Do you understand what I mean? Like Uber, yeah.
Yeah, well, I'm thinking, Lisa, how does it make you feel?
I feel anxiety. I need this AI to detect my voice. No, I think it's not a good solution, also not a good progress in this direction, because I think variety makes the world better, and to have more competitors also brings you to better results. So we all need a competitor to be better. I think also in daily life and work life, everywhere. So it lifts you a bit up. Yeah. So I think this is for me personally, it gives me a bit anxiety because 4 main players, okay, what the fuck, they will control us. But also from the business perspective, I think there will then be a steady state, and then it will maybe also fall down again because there's no competition anymore. But Rico, what do you say as a founder and CEO?
Same, and partially you already see it, right? When you look at the big tech companies, we are moving totally away from healthcare to tech. But honestly, they are also covering now also healthcare. They want to rein everything, right? All the sector segments. When you look at the big US companies, you already see it, right? They put pressure on politicians, on regulations, everything, and they basically dictate the world. But however, they also let pressure be put on them, right? So they all try to be friends with Trump, I can name it, and try to make it right and to please him. And I mean, I think this is how a bit the world goes. And when you look at Google and what they did to society, or in a good way, right? When you look at Google Maps and Google, the search engine, it's amazing. Really, they put so much innovation on the market, but then how capitalism works is it does not stop. You need to continue, and then you start to go into segments and sectors and also apply practices that are not superhuman anymore, or maybe always ethical. And then you try also to own more of this market share here and there. You come with a very good vision, and at some point you need to follow on this track, and then it starts to be just a capitalistic story anymore. And this is, of course, this hurts the market. This hurts much progress. It also concentrates wisdom, but also money, prosperity. So yeah, there's a loop problem, and it should break up or break out. How do you say?
Yeah.
Okay.
Break apart. And I think also from the users, what you said, Rike, is 100% correct, because innovation then stops, right? Everybody stops thinking about solving the user's problem. If you use the Google Maps example, Google Maps used to compete with Waze, at least in the US, right? This is what made them really, really competitive, because they had competition. Same thing with search back in the day of Google and Yahoo search and Bing, and it was getting better and better. Search, can I swear on here? Search is quite shit today, and that's because Google is running a monopoly. Google Maps has not been improved in many, at least not on a large scale in many years. That's because they're running on a monopoly. I can only imagine how bad that would be when it translates to something like healthcare or even preventative medicine or anything adjacent. We cannot, I think regulation has to come in, government regulation has to come in, where we cannot have monopolies running the world. Yeah. Okay, that's my passionate plea for today.
Sorry, I need to add. Sorry, there's so much more to add. 100%, everyone is okay, state and the regulations, they need to go away and go off. But then, when things are not working the way everyone wants, then they're okay, regulations need to come back. For example, I just read it. It's get your guide right. And one of these bigger companies or bigger startup companies from Germany that also said, okay, the European Union, they need to file, I think, I don't know how much it was, but like a big fine on, was it, I don't know if it's Google, but for also like really like wrong practices, right? So, I mean, basically they became market leader because they did all the advertisement on Google and were always on the first place. But then when these market kings whatsoever take all the share and more, then even like the companies that reported or that were built and became big because of them, going against them, and now everyone is crying and for regulation. So I think it's always this double-sided morality that you see and really experience everywhere.
Yeah.
Sorry, this is very like for the philosophical. This first.
I'm so excited because I love this kind of conversation.
What I think, yeah.
It's nice to talk about those things with you, and I think it also fits perfectly in our topic of the day because we also need to get a bit more serious. You know what I mean? And in each episode, we would like to discuss one topic. And today, the topic is what patients actually need that digital health still is not delivering. And I mean, it's a very specific topic, I know, and there are many topics unsolved for patients, but I think we have to start anywhere. And I think the first question could be to you, from your point of view, why digital health? Why do you think it could make a difference? And also with this sentences we just had in mind about bias and monopoly. So I think those risks could also apply there, like in digital health or in healthcare system as well. So maybe the first question I would like to discuss is, why do we think that digital health apps or something like that could really support the real life of real patients, so to say? Give me something.
You want to start, Confidence?
I don't mind. Yeah, I think from a patient's perspective, the whole journey is so fragmented, like at very different points, like especially in the US, and also as I'm learning about the EU and German market, making an appointment is so difficult. Getting an appointment with a GP or specialist or someone who can take your insurance is so difficult. Getting insurance is so difficult in the US. Like, like really minor parts, and this is just like top of funnel. Once you go into hand-holding, if you're in a treatment, if you're in a therapy, getting access to peer-reviewed studies about the medication, for example, that you're on is incredibly difficult, right? There's people, the big market kings, similar to what you were saying before, Rike, are dominating search, dominating information spread, right? So it's so hard to get access to appointments, to information, to everything, right? And so I think, and it's not democratized. I think this is the other thing, right? So then it becomes more if you can afford it, right? In the US, from that perspective, if you have access to health insurance and then you have access to a good doctor, if you live in a good zip code, then you have better access to healthcare, right? So it doesn't feel democratized at all. And where digital apps or digital solutions can really come in is that we can democratize this entire experience, right? We can give access because data is king, as they say. We can use data, give access to patients, easy appointment booking, scheduling frameworks, hand-holding for like your medications, access to like new reports and peer-reviewed studies about medications or treatments that you're on. We're basically democratizing the process. I think the entire patient's ecosystem. This is what I would say.
I mean, it's really like digital. What does it mean? Or like how did it start? It started with like pure software, right? And when you think of how it was a few or like maybe 20 years ago, right? So many people have forgotten it, but you needed to print out everything, right? So you needed to print out everything. You needed to write everything in handwriting. People could not read it. You need to send it with letters. And there was so much. Okay, so the case, yeah, but much less. Yeah, if you compare, much less. And like it's time saving. First and foremost, it's really time saving. And as you said, you democratize the access to so many more services because it's digital. You can access with a mobile phone. And before that, it was like, okay, you need to print it out. It's super complicated. You need to send it. You lost so much time. And then also what I think, services are available everywhere, like in theory, because you can have this video call everywhere. You can send a mail like right away, and you can consult somebody via chat, and they are hundreds of kilometers away. So this is definitely how it can help. And then also second, what you said, and this is still the problem today. Everything is so fragmented and everyone just thinks about a very just specific problem and then they solve it. But then when the patient continues on that journey, again, there's a new tool, a new digital a new online service, and they need to restart everything. It's not connected. So I feel digitization has maybe if you think of the perfect world of digital, maybe we are 10% at all.
But don't you be afraid of this monopoly state? I mean, right now we are democratizing everything, but I think there will be a turning point as well. And when we think about some other names, I will not name it out loud, they're already on the market who are reported to be not that democratic anymore. I think we know what we are talking about. So, I mean, there is also a big risk, and there we have real patients. We have healthcare data. So it's not about like Amazon, what are you like delivering? Who cares? Like it's data, yes, but it's not healthcare data. I think there could also be like the risk, right?
Yeah, I think there's a threshold. I mean, similar to what Rike said before, like I'm very pro capitalism. I know that that did not come across at the start of this podcast, but I really am pro. But I think there's a tipping point, right? We're not even close to that tipping point yet. So I think that there's still a lot of room for innovation in healthcare. But I think that digital health companies need to lobby, need to get more politically involved, right? We need regulations that will prevent future states or like future situations of like monopolies or like people hoarding most of the market. But I think on the positive side, we're not there. We're not even close to being there yet. So I think that there's still opportunity. And yet the problem of fragmented patient journeys, not having access to data, not being democratized from like a socioeconomic perspective, there's still so much room for innovation before we get there. Right? So I think that's why this space is still really exciting for me.
I think, Rike, you will be the one answering now. And what is the hardest part of managing chronic condition, like what we completely underestimate?
I mean, I think a chronic patient can answer this so much better, right? Because I don't really have a chronic disease, right? I have things that are going on in my life and that are always there, small disease-wise, and come back. But I just imagine if I had really a chronic disease, that I always feel anxiety, and that I'm fearing what's next, right? What's coming, and that I would always watch out for the next big thing I could do to make it better, to feel better, right? So that like today the reality is you go to 10 different doctors or to 5 different doctors, you have 10 different diagnoses and 20 different treatment options. It's a bit over-exaggerate, but the truth is it's always like, did you get a good doctor? Did you get a good advice? And then also, honestly, when you consult LLMs, it's a bit the same because they're trained a bit different, right? And you get lots of options. But then what is the real option? And then context information is missing data. So I think you always, like I would always feel personally unsure if I'm in the best state, if this treatment is really the best one, if there is something people are missing, my doctor is missing, I'm missing, if there's a new study, if the dosage should be different, if I should take another medication on top, another nutrition product. So I would, and you hear it all the time when you speak to cancer patients. It's like there are different therapy options, but I don't know if I should take them on or not, if I should do this and there. And there's so much uncertainty and so many options. And I think we honestly don't, there are so many things we don't know. And this is what would make me as a patient be very, what I would fear, where I would be every day just thinking about, is it the best I can get, or is there something else personally? But I think honestly, when you talk to patients, they share this. Yeah,
we will. I think we will get there to also get the chance to talk to patients. But maybe then the last question from my side would be, if you could change one thing about how patients are supported through a long-term condition, what would it be? And I think this is very interesting because you are both working with a digital treatment companion app, so to say. So you are actually also trying to solve this problem, what to change and how to support with a long-term condition. So yeah, I'm interested.
Confidence, you're working on it every single second. It's your question.
I mean, I'm happy to answer this. I think from a data perspective or like a product perspective, triangulation. I think from a patient, your data, your life exists in so many different systems, right? They go to your doctor couple of times a week or a month or whatever, they get prescribed a medication. Who knows what lifestyle factors they carry on after that, right? They get prescribed a medication or whatnot. Who knows how well they adhere or don't adhere to the medication. They have other like biomarkers, some like genetically predisposed, some from like lifestyle influences. They have a typical diet. They maybe they're not drinking enough water, whatever. The point is we're existing in exactly, but the data is existing in so many, disparate systems. It's so scattered. And I really think the one thing I would love to change, this is my end goal to change this, is to really triangulate all of these data points. So every patient, especially a patient with a chronic condition, has a 360 view of their situation at every point in time, right? How is their medication adherence interfering with their lifestyle choices, with their everything else on a day-to-day basis, and then they can make better choices moving
But
forward.
who's taking care of the data? Who is like evaluating it? Who is like reacting to this?
The thing is, the data exists already today, right?
Yeah.
So we can. This is the beauty of AI, right? We can make sense of the data with AI, especially and this will continue to get better and better in the future. But the data already exists, right? So the number one step I would say in this funnel is triangulating the data, bringing it together, and then making sense of it. Yeah.
Then also supporting actually the healthcare professionals in getting the summaries of all the context data that is there and informing their decisions, because I really think, and it's not that I'm just saying this, that we are trained at a well-educated human medical actually can really then make the result even better than if you just had AI like giving you some responses, to be honest. So
Absolutely. And I also have many patients who are coming really like with this record of blood pressure monitoring from the watch, so to say, but it's too much. I mean, there are so many records. I don't have time to go through all of this. And to be honest, my first feeling in the moment is I'm annoyed. I mean, it's so much data and it's great, but what to do? I mean, I have to go through all this. I only have 7 minutes maybe. And I absolutely support Rike's thought to say we have to also support healthcare professionals because they need the right stats to make sense of it, so to say.
Yeah, that makes sense.
Yeah, thank you guys. It was such a nice discussion. I think for the first podcast, we did really good, really well. And Confidence, I think it's time now to say goodbye to you. Time to say goodbye. I would like to sing, but I won't do it today.
Please don't.
It was
you
really
and your
nice.
air conditioner.
Yeah.
Ja, gefällt mir und ja, Stefan,
Ja.
wie schön ist das?
Bonjour.
How are you? How was your working week?
It was wonderful, like every day. I like to be in the office. It's the nicest thing what I ever want to do.
This is
Every
the
day
irony.
I get up in the morning and I'm so happy that I can work. It's so wonderful. And today I was very happy because I knew it's Friday and tomorrow I don't have to get up at 6 o'clock.
Stefan, we thank you so much that you took your time and joined, even if the work was horrible. We are really grateful for that. And we also make it very efficiently so that you have your weekend quite fast, I would say, right?
Okay,
And
yes.
also, maybe I can directly start to introduce you to the audience, so to say. I'm very happy that you're here because now we have Dr. Stefan Heindl with us. He is a pulmonologist and has his own office near Munich and is also the deputy chair of the German And maybe I forgot some more titles, probably, right, Stefan? I heard there were some more jobs to be done.
Yes, I have a lot. I have at my birth there was something wrong with me because I didn't learn the word no, so I have a lot of
I think
jobs
we
now.
have this all in common and now in this
Yeah.
podcast round.
So I have my own practice or office as a pulmonologist. I'm treating about 1,200 patients per quarter of a year. And what I like most in pneumology.
It's a terrible word. I also can't say
Yeah,
it.
it's a very terrible word. I love intensive care medicine, and therefore I'm caring about people who are in outside patients who are ventilated and so on. So, but normally most of the patients I treat normally are people with chronic airways disease, chronic inflammatory airways disease like COPD or asthma. Some have lung fibrosis, cancer, of course. So it's a very broad spectrum of airway diseases, and it still makes big fun.
Okay, maybe we are curious and you can directly answer the first question. When you see a patient for the first 30
Yes.
seconds and you have never said, the patient has never said a word before and you don't know the patient, if the patient comes in, do you already can tell something about the patients? Do you already have like a gut feeling of what happens now? Is it mostly right or is it mostly wrong?
You look at the patients. Some of them are afraid of that when I'm talking to them. Let's think about smokers who come with the suspicion of having a COPD, and of course they are frightened because they think the whole night or they thought the whole night about what will happen in my practice, and then they are really happy, and you see them laughing. It's what we say in German, when a big stone is falling from their heart. I'm sure that's not an English proverb like this. So you see that they are very, very happy if you tell them, no, you have no cancer. So these are the most impressive things what you see when you have patients who are really in sorrow about their lung health, because they know that they did stupid things their whole life because of smoking, and then they come to you and they think really they think the whole night what's going on tomorrow, what he will find. And then I see the patients very happy. And in this moment, I mostly get them to say, now you stop smoking because you have this feeling now, and think about this positive feeling today and take it as chance to quit smoking. So these are impressions about people. Or it's the same thing if they come into you and say, do I have a COPD? Because I have friends, I heard so much about that. And then if you say, no, you don't have, today you don't have a COPD, but you have to stop because it's developing a obstruction in your airways. So these are the impressions about your patients.
And how many patients, Stefan, please be like super honest, how many patients then also long-term stop smoking?
Yeah.
Because I read like a number that many of them cannot sustain it, but they just keep going. People the problem is that people are super lazy. They like to be comfortable and they're not changing anything. It's not only for smoking, it's also for drinking, it's being overweight and so on and so forth.
I have to admit I was a smoker myself, so I can understand people who have problems to quit smoking. And I'm not angry with them like a teacher who teaches his pupil and say, you really know what you have to do now. It's different because I'm talking to them more like a father and say, I know I quit smoking 20 years before. I know how difficult it is. So I try that the patients never have the feeling that I'm angry with them. Some of them come in my office and say, oh, I have to admit I did something very, very bad. And say, no, it's your turn.
Yeah.
You don't bother me, but it's your health you are really, you have to think about. And I think this is the main difference. Your questions, how many patients quit? It depends.
How many people keep going?
Yes, a lot of them.
Yeah.
But if you get in such a situation where they are really afraid that they are seriously ill, and you tell them, today I have big news for you, and you can be very happy that at this day you don't have a cancer. They are so lucky about that. So I get them in this moment to say, okay, when they quit from smoking and they come for control, they say, the way you told me that, and I show them the Fletcher-Peto results in a graphic, and there they can see that the only way to get rid of the obstruction of the disease is to quit from smoking. Then they say, I remember this, what you showed me, this graphics, and that the way you told me that was for me so impressive that it was easy for me to quit from smoking after this. I don't want to say that I'm special in this, but I try not to be too hard for them and just use the situation in this moment when I got them and say, see that feeling, what you have now and what you can do for yourself. And maybe this is sometimes the possibility that you get them and then they get rid. And then they can quit from smoking. But you're right, a lot of them can't finish. And I know this with me. I stopped with 44. And I had times when I worked at the intensive care unit, I smoked about 3 packages a day. And I had yellow fingers in the morning. And therefore I knew, I know that it's so difficult to quit from smoking. If you think you need that for you're nervous and you smoke to get rid of the nervosity, but it's absolutely stupid.
Yeah.
But I know
I just want to drop one number because I want the listener to also get some numbers. I read that 30 to 40% actually do not stop with the things that got them there, but they just continue eventually. So
yes,
30 to 40% at least are not behaving as expected.
And Stefan, what do you think about the other methods that help to quit smoking? This would also be interesting.
Yes, they are very important as well. You have, if somebody or if your patient doesn't quit with that, what you are talking to them, of course, you need these these apps what you can have. And of course, it's very useful to have that.
It is all the
Yeah,
also the
absolutely.
clusters.
You can offer some of them, if they come back and say, I really tried and it was impossible for me to quit from smoking, then you can give something and say, listen, do you have an app here? And you can and what they have good success rates with these apps. So it's a good thing to have that. The other things like getting rid of smoking with chewing gums or nicotine plasters. I know it from myself. You don't need that because I smoked a lot and the only thing what I experienced was not so good sleeping for maybe a week. And then I had nothing else. But some of the people, they need something that they need. And maybe it's a placebo, but of course they need help. And such an app is absolutely very important.
But maybe what would you also say a patient who gets now newly diagnosed with COPD, for example? So you would tell them to quit smoking if they smoke. Is there something else? So what is the most valuable thing you could tell patients who are newly diagnosed with COPD, but also maybe asthma?
Yes, I tell them a lot of people don't know what we are talking about. So you have to explain that. A lot of smokers know that there is the possibility of COPD, and then you tell them that the medication is just for a symptomatic treatment, but the main thing is to get rid from smoking. With the asthma patients, it's different because you can explain them the disease and explain them how they could treat their the dyspnea, and this is the main thing that they don't have enough air for working, for walking, for exercising, and so on. And there, it's very easy to tell them just. If you inhale, then you can treat yourself. And I prefer the MAT therapies, maintenance and reliever therapies, so they can decide what therapy they use. And they are very effective. And I'm explaining them the therapy, and I explain them how to be adherent to the therapy. And then normally it works quite well. Yes, in further time, I didn't show the patients the correct inhalation technique. But then I noticed sometimes that my colleagues how they trained the patients, and I asked them then, listen, what you're telling them, and then they're looking at me and say, we do this all the time like this. We ever have done this like this. So I understood I have to do this by myself because I'm the only one who knows how the inhaler is used correctly. And therefore, if I prescribe an inhaler, I show the patients how they inhale or how they should inhale correctly. Then, of course, I tell them about the YouTube channel about inhaling so that there is a possibility. There are pharmaceutical companies. They have a QR code on the inhalers where you can have the video. So this is a very good approach to improve inhaler techniques. But it's very difficult. If you take a pill, which you have to take every morning, you swallow it, that's easy. But inhaling and to teach the patients why it is so important that they have to inhale correctly, that it's the deposing of the medicaments. It's very important where they are deposed. And therefore, they have the most common fail of inhalation is with a dose meter, pressurized dose meter. With a spray, they inhale too fast. So everything stays in the throat, and then they have side effects like mucus in the throat, fungi in the throat. And that's very hard to tell them, no, you have to inhale very, very easy. And these are very common failures in inhaling.
Stefan, I need to, because I just remember that I also had asthma when I was like a young kid, and I remember my spray. But I took it like I don't know if I took it regularly, definitely also, but also when I had very like strong and heavy activities. And I remember that I inhaled super strong, like this. And this is wrong, but so now you would say, oh my God. But this is how I learned it. I remember it was like always that you need to take a super like deep breath to get it inside, and you saw it's wrong.
See how funny it is. You need a podcast today to learn the correct inhaler technique.
20 years later, 25 years later, but I remember I did it. Yeah, I just learned. Yeah, right now that it was wrong. Okay, thank you, Stefan.
Probably
You have to. You have to coordinate because you have to start to inhale and then you have to press because then you have with your inhalation breath, you take the aerosol with you and has to be deponed in your airways. But if you inhale like you describe it, maybe it's only in the throat. Maybe you had a funny throat in these times. It's a very wide throat because of
Yeah.
no, it hangs. It hangs. It has to be. It has to go very, very smoothly, and you exhale, and then you have to keep it and have to count until 5, and then you have to exhale via nose. Then because if you blow out everything, so maybe it was not an asthma. Maybe you have to come to me again, and maybe it has to be
No, I
re-diagnosed.
really did it different. I didn't do it like this. But you know what? This could be not our podcast of the first episode, but this is like how to inhale correctly. This should be the title of this podcast for everyone. Yeah,
Right.
because I did it wrong. I definitely did it wrong.
So what would you need, Rike? A better doctor or a better app? This is maybe the question, right? Since you are both in the room. Both. I also think so. And since you're both here in the room, I have to admit that you both also know each other from before because there is a collaboration between pulmonologists and also the Brite app. Maybe, Stefan, for you, I also heard that you are digital affine, so to say,
Yeah.
YouTube and apps and so on. So maybe you can give us 2 thoughts on this digital health approach in the healthcare system as well. So what is your first honest reaction when you heard that the digital health companion approaches you as a doctor or the medical association itself? So what was your first thought maybe on that?
Yeah, honestly, the contact was brought to us by a pharmaceutical medical liaison manager. I know her, I knew, and I know her for a long time. And she asked me to come to an online meeting just to look at a startup company which has a digital medical approach. And she wants me to see what it is and my thoughts about that. And therefore I came there and if you remember this, I need maybe about 20 minutes to understand what you exactly are doing. And then I think it was the same setting. It was a Friday or I was tired and I didn't listen maybe as I should have done it. But then, and all of a sudden, I just understood what you exactly are doing. And I understood the big chance to have one platform with all the possibilities for a better care for patients and to gather data, which is very important for us because then we see how we treat and how we treat our patients. And in the first time, to tell you the truth, I thought, oh my goodness, another startup who wants to bring you something. But then when I understood it, then suddenly I said, oh, what a big thing. And that I have to admit, this was my second look. And now the third and fourth look are even better. So
That's good.
it was difficult in the beginning and I didn't understand it in the beginning, but then when I really, but it's hard to understand what you're doing. It was
Getting better,
I
Steph.
really,
Getting better.
it's very and now when I see it, how to explain it to my colleagues and to explain them the necessity to have such a thing, it's very, very difficult. And then they ask what we have, what's our benefit, and is it difficult for us? Is it more work for us? To tell them what possibilities are in there and the digital affinity. In fact, I get a zip package of data from you and I import the whole zip package in my database now and together with artificial intelligence, we have the possibility to see the patient journey that nobody has these data. So we can compare the combination of oral corticosteroids with exacerbation in COPD and asthma. And this is a absolute big opportunity for us. And I'm really very, very happy to have this co-work with you. And I'm very happy that I understood it after 20 minutes.
Yeah. Stefan, we should stop here because this is not an appraisal for what we do. So I'm really happy that you said, and you need to be honest, and it's absolutely right. There are so many digital health ideas, I would say, that pitch something and then you look at it and see, okay, if there's just a prototype, it's not really working, or like they didn't test it. There is no real market access. But it's true, maybe communication and what we do, how we present it, it's not our best chance. And this is funny because I heard that somebody said about me, I'm the best salesperson on earth. But then the reality is that many people actually don't get what we are doing. And because I feel a bit like this founder that is so super motivated about the idea that I talk very much about details and every specific point, and then people from the outside are like, yeah, but what is the big picture? And yeah, so it's good. We are very intrinsically motivated, and oftentimes this is why people don't get it. But yeah, more questions. I have more questions to Stefan because I have you here. Stefan, if you could imagine, how would your perfect day in your practice would look like, for example, in 10 years? What would you expect from your patients, from your digital infrastructure setup? How would you like to see a doctor's daily life in 10 years?
So if you ask me specifically in 10 years, I will be retired, absolutely. And I'm not longer here. Maybe I'm in Thailand and I'm sitting on the beach and enjoying my life. No, seriously. I think the future of medicine must be digital. It's in Germany. It's such a pain in the ass that we are so behind the world with our possibilities. And if you think about electronic patient records, what we have, that's so stupid. It's really, you can't use this because there are no indexed reports, no indexed values what you can share. It's so difficult to find a report there. So my idea about the future of working as in your own practice and working as a doctor is digital. There are no more barriers in between the sectors, so there can be a border in between the clinics and our area. So, and we need, of course, I saw this week, I saw a project that's called Guide AI. So these are AI solutions for doctors, and they have studies with that. And this is a great thing to have an AI just for helping you for deciding the right therapy after guidelines, and even from economic reasons in our system that you can prescribe a medicament without being afraid that you have that you are forced to pay back because you did something wrong, uneconomic treatment, and so on. So this is my idea from the future, that it has to be changed to digital. I have also speech recognition. I have already the digital patient, I don't know, anamnese in English. What is that word? Something like this. I have this already, and we have the possibility that we have an assistant which is able to make appointments. So we can go back from the telephone. We can get rid of that really annoying phoning with patients. You have to consider that we don't have the employees who are working for you. So there must be a total digital environment, and this would be my dream. But I don't think that I will meet this super idea. I think we still have a lot of work to do.
And what do you wish from your patients in the future? So also with this digital approach, so what would be an ideal patient be then?
I think an ideal patient would be a coherent patient, so an adherent patient who really understands his treatment and who really knows that it's important what you give to him. Patients are thinking how I have to care about their fears, why they don't like to inhale. It's funny. I have a COPD patient on a biological treatment, and then now we have the electronic medication list, and I saw in this list that she didn't use the fixed triple therapy. And I asked her why she doesn't take this anymore. She said, I'm afraid of inhalative corticosteroids. So it's funny because to tell her that you have, but you don't have only the corticosteroid, you have two other medication or medicaments. And she really is afraid of the inhalative corticosteroid. And I said, that's impossible. Your life hangs up on it. and she is afraid of such a stupid thing. So it's funny that they are afraid of inhalative corticosteroids and smoked for her life. So it's and therefore we really need further information, and we really need your app, because patients need to have information where maybe you can teach them what inhalative corticosteroid really does and how it's working. And these are the informations patients need, so they stay adherent to their therapy. I think this is very important, and therefore I really appreciate your app and your work for the quality of treatment of our patients.
Thank you.
Cool. Thank you so much. I think this was a very nice first episode of this podcast. And maybe to finish and to wrap up, I want to ask Rike especially, because you were here all the time, and I also will take a summary. What is your key takeaway from this episode? So what do you want to share with the patients outside? One thought, or what did you learn today? You learned that you treated your asthma not correct.
Not correctly. So many things. What I really like about this podcast, also for me, it's super interesting to talk. You know, usually when you talk to people, like, for example, with you, Stefan, we always talk about like just one, like our business or our collaboration, but we actually never ask you other questions around it, right? So, I mean, I know it's obvious, but I think oftentimes asking other questions that you learn much more about the segment you're working in, the true underlying problems. I learned so much more from you, Stefan, today. Beyond, and this is not related to our collaboration. So this is super interesting. Yeah, patient adherence, that patients are not doing what they're supposed to do because they don't trust in what they do. Also having a really good doctor and a good digital tool. This is two things we need to have. This is what I also can take as a key takeaway. I know it already. I mean, I also have different doctors. Some of them are good and some of them are not good, which unfortunately you always find out too late.
Yeah, I think we can agree probably, Stefan, right? This is what we also like to.
It's funny that when we are talking in English, you change the pronunciation of my first name. It's no longer Stefan, like we say in German. It's Stefan. That's very interesting.
Next time we will do it in Italian, then I will say Stefano.
Yeah, Stefano.
Stefano.
Yeah, I think this is a really nice takeaway. And we would also like to encourage all the people outside who are listening to this podcast. You can also share your challenge with us, with your chronic disease, with your chronic condition, because I'm pretty sure we forgot so many things and we are only be able to highlight some things in this short period of time. So please tell us. We can also pick it up for the next episodes, and you're also welcome to join one episode if you want. So we want to hear from you. We want to hear your point of view, and we are also happy to discuss in a round like this your challenges and your everyday life. And with this,
you know what? The next podcast, we really want to have like one patient with another doctor, and then patients tell this doctor everything what they honestly think about doctors, and then the doctor says to this patient what they really think about patients. Oh my gosh, this would be amazing.
And we do not have to do anything, Rike.
Yeah, no, we're going to do it 100%.
So, Stefan, I don't know if you're in for this idea. We will discuss further. So you can be happy that this was your episode today. So you're out like forever. You did a great job. Thank you so much.
Thank you so much.
We are still on fire, actually, but we need to end. Yeah, we'll keep you posted. We see you in the next episode. We are very happy that you joined, and see you the next time.
See you next time.
Thank you. Bye.
Bye-bye.
Yeah, guys, thank you so much for listening. This was already the first episode, and we're looking forward for the next one. So check our socials and the description of the video. And yeah, of course, like and subscribe. We are looking forward. Thank you so much.